One of the things I think is so critical in maternal health care is to really be intentional about shared decision making. I often say to residents and medical students that from the provider's perspective, shared decision making does not mean the patient shares the provider's opinion about what to do at the end of the conversation. So there's so many things we think about in healthcare, particularly in the postpartum period. What method of birth control does a patient want to use? Does a patient want to use birth control? And as a OBGYN resident and a medical student, I was trained to go and make sure that she gets a good birth control method because your job is to talk her into it. And it's actually not our job to talk a patient into a birth control method. It's our job to find out what a patient's desires are about future pregnancy. Do they want to be pregnant again? If so, when? And then based on that, think about what's a good way to accomplish that. I think that it's really important to frame this as the shared decision-making brings two experts to the table, at least. One expert is the patient, and they're an expert in their own lived experience and values. And then the other expert is the provider, who has some medical knowledge or training to help inform decisions the patient might want to make.